verbiage and patient acceptance. Understand that how we talk to our patients is very different about than when we talk between ourselves, right? So first of all, what should we tell patients Perio Protect is? Well, this is a take-home therapy for daily use. You all are still going to do everything that you normally do at the chair. That isn't going to change. But patients need more than just what we do at the chair. You and I both know that. We're magicians at the chair, but it all comes down to their home care. What are they doing for their home care? So, like I said, this is the take-home therapy. That's the secret weapon here. These are custom-made trays. They have to understand that these are custom-made for them, not their brother, not their sister, not their mom, not their dad. There's a seal on the inside of the tray that works like a gasket. This gasket helps to deliver the medication deep between the tooth and gum. And typically they're going to ask, what's the medication? And you're more than welcome to tell them hydrogen peroxide. And remember, hydrogen peroxide is an antimicrobial and a wound cleanser. They understand that terminology. And these are lifelong trays for a lifelong disease or lifelong prevention, right? So next, I think it's critical that you all show this video. I've sent it out to the coaches, and I know we're going to put it in some of the links here too for you to get, but you've got to talk through this video, or you can download the voiceover of Tanya. And basically, you know, here's our oral cavity. There's an area between our tooth and gum where we accumulate plaque, bacteria, toxins, causing a bacterial infection that we cannot reach with toothbrush, floss, and rinse. So how are we going to get that area clean and kill that bacteria? We're going to wear Perio Protect trays, which are a custom-made, comfortable tray with special medication that worn for 10 to 15 minutes a day, kills the bad bacteria, and it improves your breath and whitens. So that is, it should be as simple as that when you're talking to patients. Shouldn't be any more in depth because you're going to lose them. Okay. Again, you got to stress that toothbrush, floss, rinse doesn't reach 4, 5, 6 millimeter pockets. Now, they may also ask, well, how deep of pockets will this reach? And we can get to 9 millimeters. So remember that number too. But you know, you have to stress keywords: infection, bleeding. If you have bleeding, you and I both know 45 seconds is the time in which blood circulates. So where does this infection go? It goes to our brain, right? Or it goes down to our heart and other organs, because our mouth is right there, right? It's going to go one of two directions. So we are trying to get to that infection before it travels. But any kind of bleeding, we need to address, we need to discuss, whether it's on probing, scaling, flossing. This is your cue to talk to patients, okay? Keep it simple. Okay, 2 parts, right? It's 2 parts. This whole system is 2 parts, the tray and the gel. The gel is the hydrogen peroxide. And that's really all. I mean, that is super easy. We're not asking them to get some expensive medication. The high-end cost on this is the beginning, and that's because these are trays for life, right? Trays for life. Hydrogen peroxide. Sometimes they're going to ask you, what does it do? And I keep it super simple. It's an oral debriding agent. It's a wound cleanser. It's also an antimicrobial. A lot of people understand antimicrobial these days. And I also tell them it kills the bacteria layer by layer, just like an onion, right? You put the trays in, you wear them for 15 minutes, it takes off, it kills one bacteria, one layer of that bacteria. It's natural and holistic because we make hydrogen peroxide in our body, so we're not allergic to it. And you can't build up a resistance to this as you can antibiotics, which is another great point to communicate to them. And then it's also safe for pregnant and lactating. So where we can't use a lot of other medicaments, hydrogen peroxide is fine and safe. Again, remember to tell them 10 minutes, we get the actual kill, 15 minutes for full oxygenating benefits. I typically don't ever tell them 10, I tell them 15 because it's just like toothbrushing, ladies and gentlemen. We tell them 3 minutes. We're lucky if we get 1.5 to 2. So I know if we tell them 15 minutes, we're going to get 10, but I truly would love 15. And remember, if they ask you, well, how am I going to know it's 15 minutes? Well, you can set a timer, you can do whatever. But if you wear it longer than 15 minutes, it's okay because at the 17-minute mark, it breaks down into oxygen and water and it's not going to hurt them. Okay. So it's not going to hurt them. And what we also have to do is we have to get them to commit. We got to get them to commit to wearing these trays every day. So work it into their daily routine, something easy. What do they do every day? You talk to your patients all appointment long. You can draw something out of them. But here are some suggestions. Checking emails. I know when I get up in the morning, I check my emails. It takes me anywhere from 15 to 30 minutes. You have all those young adults and I mean even my kids and they're older, they're scrolling Facebook or Instagram. I know they spend more than 15 minutes. They're into it, man. Morning routine. I think this is the easiest. Pop your trays in, jump in the shower, do your hair, do your makeup, jump in the shower, shave, do your hair. That's 15 minutes, right? For anybody, even the fastest people on earth. It's going to take them at least 15 minutes to get through their morning routine. And then take the trays out and brush. We know that if we tell them to wear the trays before they brush, their brushing is more effective. Okay, because it's broken down part of that biofilm already. So they're going to get a better result from brushing. Favorite shows, walking your dog, running the kids to school or their activities. Any kind of windshield time is great for this. And then remember, when you're talking to them at the chair, talk about their gum score. Gum score is the bleeding points. Yes, you have to probe. They understand numbers. They understand blood pressure. They understand cholesterol. They understand their A1C. So give them their gum score. It's the bleeding points. Anything over 10 is not healthy, right? You all can pick a number for your practice. I say 5 and under, I'm going to be pretty happy with, but we know the research shows 10 and under, but let them tell you what they're going to do to make themselves better if they have a high number, right? And then you can talk to them about decreasing their bleeding and infection with daily use of Perio Protect trays. It's pretty simple. Mr. Jones, I'm concerned you have a high gum score. Your score is 68. This means you have 68 areas of bleeding and infection in your gums. The ideal score is 0, with less than 10 considered healthy. I know you're trying hard at home, you're brushing, you're flossing. It's not your fault. The problem is toothbrush, rinse, floss, they don't get deep enough to fight that infection. So our office prescribes Perio Protect trays. It's a comfortable tray that delivers medication between your gums and tooth, holds it there for 15 minutes so it's effective and it kills that bacteria. You not only have healthier gums, but decreased bleeding, whiter teeth, fresher breath. That's as simple as it is. You really don't have to get into anything else. And guess what? I would always talk about the additional benefits, which are fresher breath and white teeth. Now remember, fresher breath with this system, you're going to see fresher breath in less than the first week. It's going to happen in a couple days. Guess what? If you have morning breath, this is for you because it's attacking that bacteria that causes the bad breath. It's going to whiten. Now, the whitening, I always tell them you're not going to see whitening effects until about 4 weeks, 6 months, or 6 weeks, even better. Okay. So don't promise them whitening overnight because it doesn't happen. It takes 4 to 6 weeks. And just for any of you, remember, as long as you diagnose someone with gingivitis or periodontitis, so a perio maintenance, 4346, SRP, these trays are eligible for HSA and FSA. And that's just a little something extra for you all to know. But that's pretty much all there is to talking to patients about Perio Protect trays. Keep it simple, use their language, but you got to talk to every patient with any sort of bleeding. Okay? Does anybody have any questions for me? Oh, hang on. Let me get to the chat. My team doesn't receive weekly emails, and I was wondering if you're able to help me with that. Who is your coach over at USEGI? Who is it? Oh, you're typing. Candace. No, that's your territory rep. Who is your coach? Is it Nicole? Is it Natalie? Is it Esther? Is it Jody? I'm talking about your strain. You don't know. Okay, I will find out for you, and I'll make sure that you get added to these weekly. And you don't get the newsletter because they're putting a lot of information in the newsletter. Okay, I will let them know. I'll try to help you with this, and then a lot of times they're putting a link to the recordings. They're putting information in there. So I will make sure that I get you caught up. Okay. All right. If there aren't any other questions, everyone have a great afternoon. Thank you. Oh, okay. Yes. Okay. Rinse with hydrogen peroxide. It's not the proper percentage, right? They can hold rinse in their mouth for 15 minutes, nor is it going to get to the base of the pocket. Okay. So it's not going to be delivered to the base of the pocket. They can't keep it in their mouth, and it's the wrong strength. Okay. The 1.7% does not cause any sort of sensitivity or any other side effects. Okay. Anything else? All right. Have a great day, everyone. Bye.